I'm Joseph, and I'm one of the pharmacists on board, and this is Xavier, and we're here to talk to you about Mr. Harold Williams. He's a 63-year-old male who came in recently to talk to his family physician about 2 weeks ago. He came in with a chief complaint of a dry cough, back pain, and weight loss over the past 6 to 8 weeks. Background information with Mr. Williams is he's married, he has 3 kids, he has a 20-pack year smoking history, and he quit smoking about 10 years ago. He has no allergies, and his current medication list consists of taking amlodipine 10 milligrams daily for his high blood pressure, atorvastatin 40 milligrams daily for his high cholesterol, and he's taking Motrin for his back pain. A chest x-ray revealed a left lower lobe mass and changes in his thoracic spine, suspicious for metastatic cancer. He has some back tenderness in his thoracic spine. The bone scan came back positive for metastatic lesions from T2 to T4. We also did a CT scan on his abdomen and pelvis, and that came back negative. He currently has an ECOG score of 0, which indicates that he's asymptomatic. So he's fully active, and he's not showing any physical restrictions. His pertinent lab values came back within normal range. His white blood cell count, though, however, is a little low. His neutrophil count, his platelet count, and his hemoglobin count all came back within normal range. I'm now going to pass it on to Xavier, and he's going to cover more with the assessment.
All right, so since he was diagnosed with stage 4 unresectable lung cancer, his goal is no longer a cure, but palliation. We want to also increase his quality of life and prolong his life as much as possible so he can spend some time with his grandkids. Because of in the counseling session, the patient mentioned that his pain level was an 8 out of 10. Our assessment is that we should discontinue the Motrin, and he should be started on an opioid treatment to better manage his pain. Our recommendation is that Mr. Williams should be started on a dual therapy with cisplatin 150 milligrams IV and pemetrexed 1,000 milligrams IV on day 1, for a total of 4 to 6 cycles, followed by monotherapy with pemetrexed for continued maintenance treatment. To control his side effects, he should be started on folic acid 1 milligram by mouth, starting day 7 before pemetrexed and continue 21 days after. We're also starting him on vitamin B12, 1 milligram IM injection prior to treatment, then once every 3 cycles for the management of his fatigue. We're also going to start him on dexamethasone 12 milligrams by mouth on day 1, followed by 8 milligrams on day 2 through 4 to treat the short-term nausea caused by the chemotherapy. For his management of the pain, we're going to start him on oxycodone 20 milligrams extended release tablet every 12 hours for continuous pain, and then we're going to give him oxycodone APAP 10 milligrams and 350 milligrams every 4 to 6 hours as needed for breakthrough pain.